Hello and welcome. Today we're diving into the intricate world of heart block, a condition affecting the electrical pathways that control your heartbeat. We'll explore what heart block is, its causes, how it's diagnosed, and what treatment options are available. Understanding this condition is crucial for ensuring optimal heart health. Let's get started. Heart block can arise from a variety of factors. One common cause is age, related degeneration of the heart's electrical system. Conditions like coronary artery disease, which reduces blood flow to the heart, can also contribute. Certain medications, such as beta blockers and calcium channel blockers, can sometimes cause or worsen heart block. Additionally, congenital heart defects, infections like Lyme disease, and even autoimmune diseases like lupus can play a role. In rare cases, heart block can occur without any identifiable underlying cause. To understand heart block, we need to appreciate the heart's electrical system. Normally, electrical impulses originate in the sinoatrial SA node, the heart's natural pacemaker, and travel through the atria to the atrioventricular valve node. The AV node acts as a gatekeeper, briefly delaying the signal before sending it down the His-Purkinje system to the ventricles, causing them to contract. Heart block occurs when there's an obstruction or delay in this electrical pathway. This disruption can manifest in varying degrees of severity, impacting the rhythm and efficiency of the heart's pumping action. The prevalence of heart block varies depending on the specific type and severity. First-degree heart block is relatively common, particularly in older adults and athletes. Second-degree heart block, especially Mobitz type T0, is less common and often associated with more serious underlying heart conditions. Third-degree heart block, also known as complete heart block, is the least common but most serious form. While exact figures are difficult to pinpoint, heart block generally becomes more prevalent with increasing age and the presence of underlying heart disease. Accurate epidemiological data is still being researched to fully understand the scope of this condition. The signs and symptoms of heart block vary greatly depending on the degree of block. In first-degree heart block, there are often no noticeable symptoms. However, more severe forms can manifest in several ways. Common symptoms include lightheadedness, dizziness, fainting spells, fatigue, and shortness of breath. Some individuals may experience chest pain or palpitations, a sensation of a rapid or irregular heartbeat. In severe cases, third-degree heart block can lead to cardiac arrest, highlighting the importance of timely diagnosis and treatment. Diagnosing heart block typically involves a thorough medical history and physical examination, followed by specific diagnostic tests. The most important test is an electrocardiogram, or ECG, which records the heart's electrical activity. An ECG can reveal the specific type and severity of the heart block. In some cases, a Holter monitor, which is a portable ECG that records the heart's activity over 24 to 48 hours, may be used to detect intermittent heart block. Exercise stress testing can also be used to evaluate the heart's electrical function during physical exertion. Electrophysiological studies, which involve inserting catheters into the heart to directly measure its electrical activity, may be performed in complex cases. Heart block is classified into three main degrees. First-degree heart block is the mildest form, characterized by a prolonged PR interval on the ECG, indicating a delay in the conduction from the atria to the ventricles. Second-degree heart block is further divided into Mobitz type I and Mobitz type II. Mobitz type I, also known as Wenckebach, is characterized by progressively lengthening PR intervals until a beat is skipped. Mobitz type I involves a sudden, non-conducted P wave without prior PR interval prolongation and is generally more serious. Finally, third-degree heart block, or complete heart block, occurs when there's no communication between the atria and ventricles, resulting in independent atrial and ventricular rhythms. Treatment for heart block depends on the severity of the condition and the presence of symptoms. First-degree heart block usually requires no treatment, unless the patient has other underlying heart conditions. Symptomatic second-degree heart block, particularly Mobitz type C, and third-degree heart block typically require a permanent pacemaker. A pacemaker is a small electronic device implanted under the skin that delivers electrical impulses to regulate the heart's rhythm. In acute situations, temporary pacing may be necessary until a permanent pacemaker can be implanted. Medications that may be contributing to the heart block should also be adjusted or discontinued. While not all causes of heart block are preventable, certain lifestyle modifications and management strategies can reduce the risk. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, can help prevent coronary artery disease, a major risk factor. Managing conditions like high blood pressure and diabetes is also crucial. If you're taking medications that can potentially cause heart block, it's important to have regular check-ups with your doctor. Prompt treatment of infections like Lyme disease can also help prevent heart block. The prognosis for heart block varies widely depending on the degree of block and the underlying cause. First-degree heart block generally has an excellent prognosis, with little impact on life expectancy. Second-degree heart block, particularly Mabitz type 2, and third-degree heart block carry a higher risk of complications, including sudden cardiac death. However, with prompt diagnosis and appropriate treatment, such as pacemaker implantation, the prognosis can be significantly improved. Recent research is focused on developing more advanced pacing techniques and identifying genetic factors that may contribute to heart block. Ongoing studies are also exploring the potential of regenerative medicine to repair damaged heart tissue and restore normal electrical conduction.